My name is Dr. Mariam Kirvalidze, and I'm presenting on a case I saw during an urgent care rotation as a resident at GoHealth working with Dr. Michael Kim, and it's a case about facial nerve palsy associated with an ear infection. I'll start with some background information on facial nerve palsy. Sometimes Bell's palsy and facial nerve palsy are used interchangeably, and it's defined as an acute peripheral facial nerve palsy. Its incidence is between 13 and 24 cases per 100,000 people. The most common cause of peripheral facial nerve palsy is a herpes simplex virus reactivation, followed by the herpes zoster virus in most common causes. Other viral causes include CMV, EBV, adenovirus, rubella, mumps, influenza, and the Coxsackie viruses. Other causes are Guillain-Barré, otitis media, and Lyme disease, which is significant in Long Island, New York, and HIV. Acute otitis media as a cause of facial nerve palsy is very uncommon, but it happens with an incidence of 0.005%. The theory behind why this happens is secondary to intrafallopian edema and inflammation and subsequent peripheral facial nerve injury in the area. So our case begins with a 31-year-old male without any past medical history who presented to us with right-sided facial droop for 3 days associated with not being able to lift his right eyebrow or right lip. His review of symptoms was significant as well for 2 days of right ear pain. He denied any other symptoms. He denied any recent tick bites. His family and social history were unremarkable. His blood pressure was a little bit elevated, 145/85, but otherwise vital signs were normal. On physical exam, he was unable to lift his right eyebrow, close his right eye all the way, and unable to smile on the right side, as shown in the pictures. His facial sensation was intact. His ear exam was remarkable for right ear canal erythema with the bulging tympanic membrane with a loss of light reflex. We diagnosed him with facial nerve palsy, right otitis media, and right otitis externa, and we sent him a course of augmentin, prednisone, and cordyceps drops. We sent off blood work including a complete blood count, a basic metabolic panel, and a Lyme panel, which were all unremarkable. So this is a pretty interesting case because acute otitis media rarely is recognized as the cause of facial nerve palsy. So people, including myself, forget that these two are associated, but it is indeed a possible complication of acute otitis media. We did send Lyme studies on this patient because in Long Island, New York, we see Lyme disease more than in other areas of the country, and this is a fairly common cause of Bell's palsy here. However, his tests were completely negative for Lyme's. So although rare, our case study demonstrates that you may find Bell's palsy attributable to acute otitis media in your local urgent care setting, and it's important to be aware that this association exists and to always remember to examine the ears in cases with Bell's palsy so as to not miss a rare but important and treatable cause of facial nerve palsy.